Hello, everyone. Welcome to Therapy Clips with Dr. O. This is a special presentation from the Institute on Alcohol and Drug Psychoeducation. Tonight, our topic will focus on medication for opioid use. Now, opioid use is a disorder when someone becomes dependent on the substance. So you may hear people talk about narcotic addiction, substance addiction or dependence, but also you may hear other terms like opiate dependence, opioid dependence, and opioid use disorder. Basically, what it means is that a person who is addicted to the substance need an opioid to function normally. When they abruptly stop the drug of choice, then it will lead to withdrawal symptoms. Opioid drugs include prescription medications like Percocet, Percodan, also heroin, fentanyl, hydrocodone, morphine, codeine, oxycodone, and methadone. Our focus for this evening is to talk about the drugs or the medications that's used to treat opioid use disorder. So, the medications are as follows. You have Suboxone, you have buprenorphine, you have naloxone, you have buprenorphine in combination with naloxone, you have Victotrol, you have naltrexone, you have Sublocade, you have Brixadi. I'm not quite sure if I pronounced that correctly, but it's very close. And so now what I want to do is I want to talk a little about each one of these medications. Keep in mind that they're all used to treat opioid use disorder or addiction to some type of opioid. So now we're going to speak a little bit about Suboxone. Now, Suboxone contains a combination of buprenorphine and naloxone. Buprenorphine is an opioid medication referred to as a narcotic. Naloxone blocks the effects of opioid medication, including pain relief or feelings of well-being that can lead to opioid abuse. So in other words, it's used to treat narcotic addiction. Most of the time, it is not used for pain relief. So a doctor is never going to prescribe this medication to anyone for pain relief. Now I'm going back to the list. And now we're going to talk about the combination of buprenorphine and naloxone. Once again, this is a medication that's used to treat opioid addiction. It is not used for pain relief. It is used for the purposes of someone who have a substance use disorder, in particular the opioid use disorder. I'm not going to go through all the side effects or anything of this nature in this presentation. I'll do this at another time because basically I just want you to know what the medications are. So now we're going to talk about buprenorphine alone. Once again, it's an opioid medication, but it can also treat acute pain and chronic pain. So a doctor may prescribe this medication for someone who have an opioid disorder, but they're in extreme pain. It is used to reduce cravings and withdrawal symptoms without causing euphoria or dangerous side effects. It also helps in the prevention of relapse. It is a substitute for the drug that's being abused. So the patient has minimum discomfort, which allows the patient to focus on their recovery. Buprenorphine for opioid use disorder is part of a complete treatment program. So the person that's on that particular program receiving that medication is also receiving counseling and behavioral therapy. There are different derivatives of buprenorphine. So a derivative means that it's similar, but it's not the same. And so Sublocade and Subutex are derivatives of buprenorphine. We're now back on the list, and we're going to talk a little bit about Vivitrol. This is a medication that is injected, and it's an injected form of naltrexone, which is a medication used to treat two different types of substance use disorder. One, the opioid use disorder, and two, the alcohol use disorder, or in other words, alcoholism. It is a part of a program. So the person that's taking this medication prescribed by a physician or nurse practitioner is receiving behavioral therapy and counseling. So basically, this particular medication helps the person to stay away from opioid use and alcohol use. And basically, I'll tell you briefly again what it's used for: to treat alcohol dependence, prevent relapse to opioid dependence. And this means that a person can't take Vivitrol and then go out there and use, because it will cause them to become sick. Or go out there and take a drink. It will cause them to become sick. All right. So, you know a little about that medication. Now we're going to focus on naltrexone, prescription medication used for the treatment of alcohol use disorder, in other words, alcoholism, and opioid use disorder. It helps the person to stop using these substances and remain off of alcohol and the opioids. Naltrexone belongs to a class of drugs known as the opioid antagonists, and it works by blocking the mu opioid receptor. It blocks the effect of alcohol and opioid medication, preventing the intoxication these substances cause. So naltrexone also modifies how the hypothalamus part of the brain interacts to suppress the amount of alcohol that is consumed. This medication, naltrexone, is used to treat alcohol dependence and also opioid dependence. Now we're going to go to Sublocade, and I spoke briefly about that. Now, the Sublocade is used to treat the opioid dependence only. And it can be given buccal, that means that's in the cheek. So the person will put the medication against their cheek until it dissolves, or sublingual, and that means that it could go under the tongue until it dissolves. Sublocade extended release injection belong to a class of medication called the opioid partial agonists. Buprenorphine works to prevent withdrawal symptoms when someone stops taking opioid drugs by producing similar effects to these drugs. Sublocade is only available under a special program. You must register with the program in order to receive the medication. And so those are the medications that are on the list for discussion tonight. If there are any questions, please refer to your physician, especially if you are a person who is in need of taking the medication. But if you're a clinician that's listening to the presentation and you're a therapist or a counselor, please refer to the medical professionals that's working along with you if you need to know more about the medication. Thank you for joining us on Therapy Clips with Dr. O and our special presentation on the medication that's used to treat opioid addiction. Thank you so much and have a blessed evening.